evening. Welcome to the Westborough Board of Selectmen meeting for Tuesday, April 28th. As has been our standard for each Tuesday during this COVID-19 pandemic crisis, we've had a joint meeting between the Board of Health and the Board of Selectmen. Tonight is our regularly scheduled Board of Selectmen meeting. We did call a meeting to order at 5 o'clock tonight to go into executive session as a Board of Selectmen. We are now out in open session. What I'm going to do is we read this at the beginning of the meeting at 5, but because we weren't on TV, I just want to read this again as required for open meeting law based on rules put in place during this time of virtual meetings. So pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 38, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Town of Westborough Board of Selectmen and Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to view this meeting while in progress may do so by tuning to Westborough TV's government channels, Verizon Channel 28 or Charter Channel 192, or they can stream online, view it for online streaming at westborough.tv.org/live-stream-government. So thank you. So we will be meeting, joint meeting here with the Board of Selectmen and Board of Health, and 2 seconds, I'm going to turn it over to the chair of the Board of Health, as has been our practice, to kind of kick this off from their side. And then just to note that at the conclusion of this joint meeting, the Board of Selectmen will continue with their regularly scheduled meeting as published in the agenda. So Dr. Walsh, I'm going to turn it over to you if you're okay with that.
Yep, that works. Thank you. I appreciate being invited here and having you guys do a lot of the legwork and setting this up. That's always appreciated to everyone involved in that. I think the biggest order of business that we'd like to do is have Steve kind of update you guys on the latest numbers. I think that we've opted to no longer giving reports twice a week in a written form, and just kind of updating you and then posting a written form once a week. So I don't know, Steve, are you on the
Yeah, I'm here. Since our last report, which was last Friday, I will report that we've had 20 new cases in non-healthcare facilities and 6 in long-term care facilities. So 26 altogether since our last report. We have had 8 additional deaths, though, all of those in long-term care facilities here in town. So the totals roughly bring us over up to, give or take 200 cases of confirmed COVID cases here in town. And total deaths would be 21 at this point.
Thank you. And the other question I think that people had was just if a recap as to the mandates and the recommendations that the Board of Health has put out. And I don't know if you have that accessible or whether we have to just kind of recreate that for people.
Well, I can kind of summarize it. I don't have the writing right in front of you. Basically, on Friday, our facial covering regulation went into effect, where the board voted unanimously last Tuesday that any employee that works pretty much face-to-face contact with any of the public have to use a facial covering. So that went into effect on the 24th. I'm happy to say we've had very few complaints. We have had a couple, and most of those are just businesses that didn't know it existed. As we had spoke about last week, we have a very good email list for restaurants and the other businesses that we do, obviously regulate, but there's many out there that we don't, that maybe they aren't aware of what's going on. So I think it's an educational thing at this point for those that just don't know, and we haven't had any problem once they were told for compliance. So that has gone into effect, and it's been a pleasant surprise of the amount of places that have just gone and done what needs to be done.
Excellent, thank you. Syed or Alan, do you have anything that you guys want to bring up?
Yeah. Sorry, Dr. Erlich, did you want to say something? If not, Nathan, can I speak?
Sure.
All right, I have something after Syed. Go ahead.
No, you first, because you're the one that also wrote the commentary. I'll wait for you. Go ahead, Dr. Erlich.
Okay, I wanted to just, so I can talk about if there are any questions on the comments I wrote for the report, but I wanted to just follow up on the last item about the facial coverings. And while I feel we have the ability to enforce certain rules on the places that we regulate, it's come to my attention that there's some concern by people who work in those industries that members of the public who come into their places are not always wearing masks. And so it sort of cuts both ways at some level. And I'm not, at the very least, I would suggest we put out an advisory to support what the governor has said. I know I heard on the news today that both Cambridge and Somerville have passed regulations mandating everyone, whenever they are outside, wear a mask. I'm not in favor of that. But I think if you're going into a place where we have asked the people working there, because of the difficulty of social distancing, to wear a facial covering, then at the very least we can ask the members of the general public to do the same. And even if it's an advisory, because we don't regulate the public in quite the same way, and I'm not sure I want to put out a regulation for no reason, I would at least, if we were to make an advisory, this is something that stores that wanted to could put up a sign indicating the Board of Health had recommended this.
Yeah, so I'm in favor of that recommendation. I think that we do have the power to mandate if we wanted to use that power, and I think it would have to be enforced by the local police. But I don't think that we're ready to go that far. But Syed, did you want to bring up something new or something related?
No, I just wanted to bring couple of things up to. I know a lot of people in town listen to our meetings, and sometimes they devolve into scientific discussions, but I think it's important to underscore a couple of non-scientific things. The first being that if you look at the data, the United States now has over 1 million confirmed cases of reported infections. We've had more than 55,000 deaths. There's also again, a lot of the data is preliminary, but there's been concern that there have been far more deaths that could be counted just from COVID-19. So this, I know there's been a lot of discussion that, we want to be opening things up, but I think we as a Board of Health, need to do our part to I guess, inform the public that this, pandemic is still very much underway. I think, I guess I would want a consensus from the board that I feel that Westborough is potentially a hot spot. And I think, one of the great things that as a town that we've been doing is that, Chief Purcell sends out these messages on I think Sunday afternoons. And I think one of the things that we may consider, I think as a board, that we should talk to amongst ourselves is that we should encourage Chief Purcell in his message to identify that we are still in a place of concern. So I open that up to the board. I certainly feel that we are a town that needs to be concerned about this disease, not a town that should be stepping back to resume normal life.
Yeah, I want to agree with both the board members that have spoken. I think that we are not through this yet. I don't think we are ready to open. And I think that I'd like to take Dr. Erlich's motion to recommend that that people going out into public places where they are exposed to workers that we've required to have face masks, that they also wear face masks. I think that recommendation would go a long way toward giving the proper message that we want, that we're still not through this, and that we want to tighten restrictions at this point rather than open things up. Did you want to phrase a motion, Dr. Erlich, in a particular fashion, or?
Yeah, so I move that the Westborough Board of Health issue an advisory to the town of Westborough that all members of the public who are entering stores or other essential service areas where they will come in contact with essential workers are advised to wear facial coverings to minimize the spread of COVID-19.
I'll second that, Dr. Erlich.
Okay. We have to do a roll call vote for that. Dr. Erlich?
Yes?
Dr. Hashman?
Yes.
Dr. Walsh? Yes. Great.
If I may ask one question?
Please.
In passing this advisory, I just want to clarify that if an individual store owner wanted to take it upon themselves to require customers have face coverings on, that they could do that. This doesn't prevent the store from saying, please wear a face mask if you come in.
So I don't think that this would have any effect on that one or the other. Most stores have the right to implement any type of non-discriminatory policy. As long as they are applying this evenly to all members of the public, then I don't have any concern one way or the other.
Yeah, I think that people are allowed to be more restrictive in their choice. And this is kind of like, especially when it comes to restaurants and stuff like that, some people might require like shirts and shoes and all of that sort of thing, whereas other restaurants might not. Restaurants or other places of public are allowed to put more restrictive types onto the people that are coming into their space if they want.
Okay, thank you.
I did want to follow up, Nathan, to see if anyone from the Board of Selectmen had questions about our report on the latest update. I will preface that by saying, based on the latest numbers through this week, and I believe the governor has used this term, we are, and this supports what Dr. Hashmi had to say, we are plateauing. We don't seem to be getting worse. We seem to have reached a level, but we're not on the right-hand curve where it's starting to trend down yet. And I think if you look at the numbers of when we started going up and when our plateau occurred, we're probably about a week or two behind New York, and New York is just starting to get things under control now. So I expect we still have another week or two of sobering statistics, and particularly with regards to the number of deaths. Obviously, the number of new cases we expect to go up quite a bit as we are doing more testing, but the number of deaths are unrelated to for the most part, to the testing, because people who die tend to be in situations where the healthcare system has already had a chance to assess their status.
I have a question. So here in Westborough with our deaths, we still haven't plateaued. We're still increasing our death rate. So
I think one of the things that you have to be careful about is that in a town like Westborough that's relatively small, a few deaths, or I use the word a few, and I don't mean it minimally, can bunch together, can really sway our statistics quite a bit as opposed to a much larger population. I think what we've seen in the Commonwealth is basically COVID-19 running rampant through long-term care facilities despite best efforts. And we've seen that here in Westborough. It's been tragic. And to the best of our knowledge, that seems to be settling down. Steve and I have been in frequent communication about making sure that when they have asymptomatic patients in these facilities, they're being monitored, and that patients who are COVID positive are kept separate from patients who are not, or residents, I should use the word more correctly. So to the best of our knowledge, the facilities are all doing precisely what they're supposed to be doing. And we have to hope that if the long-term care facility situation comes under control, the deaths will start dropping rapidly.
I have one question about the masks, and then I have a couple of questions I can ask later in your meeting. When we're saying the motion you made, I think is very clear. I think there's still a question on citizens when the governor says in public, or when we might refer to when you're in public, do you have to wear a mask? So if you're walking down Main Street to get to the track and walk around the track, and you're 30 feet away from anybody you meet, I'm thinking you don't have to wear a mask then because you're not really in public and that you're not with a group of people. What is your take on that, Dr. Erlich?
The masks are a supplement or an alternative to other forms of social distancing. So we know that this is primarily spread by respiratory droplets or direct contact. And so respiratory droplets, for the most part, will only go about 6 feet. That is the rationale for the 6-foot distancing. And so if you are largely keeping yourself away from other people, then the mask isn't adding anything to that. It's when you're in close proximity, and that's why when we passed the motion both last week and this week, it refers to facilities where people are close together. I mean, when I'm in the supermarket, they have signs saying, please stay 6 feet away from each other, but inevitably you pass by somebody or even though you may pause, two people are going in the same direction at the same time until somebody realizes it. So these things are inevitable that we are in closer proximity, and we do know that indoor situations are higher risk than outdoor situations. So while it may be a good idea just for habit for many people to have it when they're outside, the benefit is much less compared to an indoor situation where you're in close proximity to other people. That's my opinion. I'm certainly happy to hear from other members on the board.
Thank you.
Yeah, I'd love to comment too. I think that what Alan said is pretty spot on. For me though, I would still recommend that if you're even walking to the track, that you do have something to cover your face. And if the other people that you happen to be passing by on the sidewalk are doing the same thing, then it just helps prevent any sort of spread of the virus. And so I would recommend that you still, even if you're out in public, have something to cover your face. But again, the board is not mandating this. You're not going to be fined or, dragged to jail or anything like that by not doing it. But yeah, I would recommend it. And I do that when I'm out, except for when I'm, let's say, doing something that's very physically demanding where I actually need to breathe hard. If I'm going out for a 7-mile run, I might not have a face covering that's impeding the flow of oxygen. But in general, if you're out just walking, I would recommend it. I don't know if Syed, if you have anything that you'd like to add?
No, not for me. I was just going to go back. Do we want to encourage Chief Purcell to share the concern that the board has that this Westborough continues to be a hotspot or not? I just wanted to finish that discussion.
I'm a little concerned about labeling Westborough a hotspot. I think that can induce a certain amount of anxiety that may not be productive. I think I would encourage Chief Purcell to do two things in his weekly message. One is to indicate that the pandemic is still at a high level in Massachusetts and that the board remains very concerned about this and reinforcing the message from today's advisory as well, that people, when they're out in interacting with essential workers, that they have a facial covering.
That sounds reasonable, Dr. Erlich. Dr. Walsh, would you be okay with that?
Yeah, I don't think a Fed chairman could have said it any more gracefully. So
okay.
Thank you.
The other thing, just one other comment. I'm sorry, I don't want to take up the Board of Selectmen's time, but just from the Board of Health standpoint, one of the things that has really impressed me about our town is that we have a lot of very creative people that know a lot more math than certainly I do, and a lot of them have crunched numbers and are in touch with me. And so one of the things that I was wondering, is it possible to ask, is it okay for these people that are ready to volunteer to help us look at our numbers, to share that information with Steve and maybe potentially improve our communication? Can I have them get in touch with Steve? And because I think I think part of our job not just is protecting the health of our residents, but it's to make sure that our message is being heard. And so I think if we can get people to help us improve our message, then our message will be heard. Am I making sense? Is the board be okay with that?
I'm certainly okay, because all the numbers that I think we're talking about are public numbers
right.
they should be freely available. And if somebody has a good idea, so much the better.
Okay, then I'll have them. Go ahead.
I would just say, if people are working on that, epidemiology and biostatistics is something that I pay a lot of attention to. I do some teaching related to that, and I'm more than happy to be involved if they are looking at those kinds of looking at it from that perspective.
Perfect. So I'll have them reach out, not to throw Steve under the bus, but I'll, Steve can triage the request. And I don't want to add to his work, but I think if we can involve people in improving the way we present our data and our message, then then that's good for all of us.
Yep. So the last thing I have is that I was on a call with the state today, and they talked about getting guidance for towns together, and they were hoping that by next week they'd have guidance surrounding a couple of issues. This would include pools, camps, and recommendations about graduations. And so I just kind of wanted to put that out there, that the state is actually working on giving guidance, and that we're looking forward to reading that before we make any decisions about those three things right now. And then the other issue was that they did release some guidance around farmers markets, and the farmers markets I think are following similarly to grocery stores in the sense that they're still trying to find ways to have them operate because food is essential, but still maintain kind of 6-foot distancing and trying to work with the people that are running the farmers markets to try to figure out the flow and that sort of thing as they run these farmers markets. So we don't have a formal policy yet on farmers markets in Westborough amidst this COVID-19 outbreak, but that's what the state guidance is looking like so far.
Yeah, we received a notice on that, so we will certainly distribute that to the farmers market that operates here in town. It had many bullet points on it as far as what the recommendations were. I didn't read the whole thing, but we'll be reaching out to them.
And then I think that someone from the Board of Selectmen had a question about tests. I think it was you, Shelby.
Yeah, I was just wondering if the Board of Health could educate the public on the governor recently said that 30% of positive tests were false positives, if I understood that correctly. And I'm just curious, I don't want to make this a technical answer, but are there some tests that are yielding more false positives than others? And can you speak to that? Like, so if I go and I get a quick swab versus, I don't know enough about the testing itself. Thankfully, knock on wood, I haven't had to have one. But can you speak to that?
So I am actually going to, unfortunately, not answer this question. I actually work at a company that develops testing for different diagnostic tests. And so it would be inappropriate for me to comment on this, but maybe Alan, if you could take this question, I'd appreciate it. Yeah,
so I'm going to stipulate by saying this is off the top of my head, and it's not based on having, I do have access to resources that could answer your question more definitively. But whenever you start talking about false positives, you have to define what do you mean by a positive. So, for instance, if somebody is infected, they will shed virus, and the swab is designed to test, are they still shedding virus? And some of these tests are very sensitive, meaning they can detect virus fragments even if the body has largely destroyed the virus. And this is not unusual, say 10 days after someone has recovered, they still may be shedding some virus. So I don't know if that's what they're describing, or simply, the person had never had COVID-19 and the test is just falsely positive. And that can be because they might have had another coronavirus that they've been exposed to, and the test is picking that up instead. And it may vary from test to test. So, so I don't know the answer to that, but I do know that when they're doing antibody testing, certainly in many parts of the country, wherever they've been doing antibody testing, which says, have you had some type of infection, exposure to COVID-19, whether you were symptomatic or not, that much higher rates of the population are testing positive than people who recall being sick in any significant way. And so I think it's still quite murky. What do we mean by false positives and false negatives right now? And, for the most part, you're just going to have to trust the tests that are done and act accordingly. I mean, if you get a test that's positive and you feel fine, well, then you're just going to wait a few days, see if you develop symptoms. You know, if after a week, 10 days, you have no symptoms, that's great. You really won't know if that's a false positive unless you have antibody tests subsequently showing that you have antibodies that you previously didn't have, and that would be how you could know for sure. I hope that's an adequate answer.
I think that's great a great general answer for the public. Thank you very much.
I did have two questions, if I may.
Sure. I mean, this is a Selectmen time at this point, as far as I'm concerned.
Thank you. I sent an email with some information to all of you, I think, about things I've been reading in the New York Times written by physicians. And one was the issue of oximeters and how important it is for people to understand that their oxygen levels are actually diminishing before they actually feel it physically. So I was asking whether or not, and we can talk about this later, we should be encouraging our elderly or our vulnerable populations in Westborough to buy pulse oximeters. So that's a question. You don't have to answer now. And the other one was several New York Times stories about people not, and the governor spent a whole half an hour on this, people not calling 911, not going to the hospital when they actually are having heart attacks, strokes, and ulcers, diabetic ulcers, with disastrous results. And I was wondering, I think Christy, in response to Syed's question last week, was going to ask Pat Purcell if he was seeing any diminished call. And if he was, is that something else that the Board of Health and Pat would like to form into a notice, like Governor Baker's notice from the hospital directors was very urgent. Like, if you're sick, call your doctor and get taken care of. Don't put it off because you're afraid of COVID in the hospital. So I wondered where your thoughts were on those things.
So that's why Pat's on the call to answer that question. And then you can talk about your oximeter question. But I also wanted to make sure that Justin, who's on the call, to talk about the Memorial Day parade, that we get to that. And there's another question from the task force. So, but I don't know, Pat, if you want to, I can pull up your slides. Oh no, that's not.
Yeah, that's for later.
Okay.
Hi, good evening. I'm Pat Purcell. So
Pat.
the answer to your question, Lee, is in Westborough, we're really not seeing a decrease of those types of calls. And I'm sorry, I was asked to put a report together for tonight, and unfortunately, I didn't have time to get it done until about a half an hour before the meeting started. I did forward that off, and I'm sure we can share that with you all later. I provided, I had to go back into YouTube and see exactly the question that Selectman Hashmi raised last week, and I wanted to make sure I answered exactly what that question was. And his questions was primarily about call volume, and I did a chart up on our call volume, which I've also submitted. In our call volume, although we did have a few weeks where it was down to about 6 or 7 calls a day, overall our call volume is up for the year by 86 calls more this year than last year at this time. What we are seeing is a higher acuity of calls of people that we have that have COVID-19 or suspected COVID-19. That is taking up about almost 40% of the responses that we're doing, which is making those calls a lot more time consuming because we have to get into varying levels of PPE. We have a captain that acts as a safety officer at all those calls, and they actually go to the hospital and sanitize the ambulance with some equipment prior to putting the truck back in service and prior to coming back into our building to protect our workforce. So I would say that we did have a small window of time, probably about 2 weeks, where the volume was down a little bit, but we're right back up from anywhere from 14 to 22 calls a day. And like I said, acuity levels pretty high. There's some pretty sick people right now. I don't know if that answered your question, but you were concerned about the strokes and heart attacks and appendicitis. And
yeah, and I think that kind of answers. Go ahead.
I think that those calls actually haven't gone away for us in town. I just think we're seeing them in lower volume because we don't have the transient population that we're accustomed to. We usually have about 30,000 more people in town during the daytime hours, and right now they're staying at home. So we are seeing them, but just on a, you know, if we were a town that was strictly residential, I think we would still be seeing a normal volume.
That's good to hear.
Yeah, I would
Chief, thank you.
answer your question about pulse oximeters. I would say that that is something that should be between the patient and their doctor. I think that if a doctor is recommending that a patient do that, they should. I think that just patients running out and going out on their own and buying them to measure it on their own, unless they know what they're looking for and they know what values are actionable, I'm not sure it's really going to do them any good. So I would say that that sort of thing should be done under the guidance of the doctor.
If I
I
can comment on
agree
that
with you on
also.
that. Okay, I agree with you that, but my suggestion was that we encourage them to get them and get trained. But anyway, your suggestion is
On that point, again, I know, having spoken with Steve earlier today, that his contacts at the various long-term care facilities in town indicate that for anyone who is positive and is, and everyone's been tested, generally speaking, people who are positive and asymptomatic are being monitored with pulse oximetry. So, I think your concern is certainly appropriate. And to the best of our knowledge, the most vulnerable people are being monitored. If you're by yourself and you're at home and you're doing a pretty good job of social isolation, then I agree with what Dr. Walsh said, that discuss it with your healthcare provider, see what's right for you. Again, it may vary quite a bit based on what are your underlying health problems or not, or lack thereof, and things like that.
Can I comment on the pulse oximeters quick? So if a resident does have an issue and they are concerned about pulse oximetry, the paramedics here are trained to use those, and we have them on every ambulance. And that's probably not something that every resident should be using, because it's a wide spectrum of what's normal, and even what's normal for somebody who's chronically ill. But if somebody does have a concern and they believe that they're having a problem, they can certainly call us, and we're happy just to come over and evaluate them. We can do that.
thank everybody.
And Christy, you had another issue or two that you wanted to talk about? Did you say the parade?
Yeah, so our veterans director, I forwarded the email that he had sent, and he is actually on the call. So Justin, I'll let you discuss what your email was, but basically we're trying to plan for the Memorial Day, how we're going to celebrate Memorial Day in light of COVID-19.
Thank you, Christy. Good evening, Board of Selectmen, Board of Health, and everyone else on this call. So the consensus, or the State Department of Veteran Services Secretary Francisco Urena recommends that we do not hold traditional celebrations this year, i.e. parades that would encourage close proximity of people. So in lieu of that, veteran service officers across the state have been coming up with ideas. It seems like a digital media of some sort pre-recorded prior to Memorial Day and aired on local access cable channels and the internet is probably the safest way to incorporate the communities and still follow the COVID-19 social distancing protocols. So I've come up with a draft program that I'm working together with the Westborough Veterans Advisory Board and Karen Henderson from the cable television channel. We're working on a draft. We have a call, I think, tomorrow or in the next couple of days coming up. Excuse me. We'd like to use some footage from previous years, different parades, some of the music, and some of the student a cappella group or the student bands from the local schools in Westborough, as well as newer footage of perhaps the chairman or the whole board of selectmen, if you so choose, doing a greeting and a pre-recorded greeting, as well as inviting the state reps and senator and having a few different speeches. It's all going to be detailed in a program, but I just wanted to, I had brought this up to Christy and she thought it would be a good idea to advise the Board of Selectmen on this. And at this time, if anyone has any questions, please go ahead and ask.
Justin, this is Ian Johnson. I think what you propose there is great. I think it's spot on. In light of the situation, I think we still moving forward and still doing a celebration of that. And the manner you talked about is appropriate, and applaud you and our veterans for taking that on. And I think speak on kind of behalf of the board here, but we'll do whatever you would like us to do in order to make this kind of celebration memorial the best that it can be in light of the situation.
Thank you. Thank you, Chairman. So I will be in touch, I guess, through Christy or directly with you, however you prefer, with further information for the Board of Selectmen once we've kind of hashed out the steps that the program will need. Thank you. And any other questions or comments?
I'd just like to say from the Board of Health side, I think that, at least from my perspective, that sounds appropriate as well. So just to kind of second the Selectmen's, opinion.
Thank you, Dr. Walsh. I appreciate that. And also, I mean, if the Board of Health would like to be involved in this with a short message, even just saying, Happy Memorial Day or anything like that, but by all means, I'm open to including as many people and organizations in Westborough that we can.
Jason, hello?
Yep.
It's Ed Hashmi. I recognize Memorial Day is, I'm just raising this just to get, so you can think about it. I recognize Memorial Day is a day to celebrate the veterans and their sacrifice, but, this year's Memorial Day, is tinged with a lot of other tragedies that have gone on that people haven't had a chance to mourn the losses that, many people have been buried without families being present. And so I did not know, and I'm just raising it for you to think about, if there's some mechanism in this Memorial Day to recognize that this is not just a regular Memorial Day, that this is a Memorial Day that is, hopefully by the time Memorial Day comes around, we will be looking at better days, but we may not, right? There's a possibility we may not. So I just raised that for you to think about.
Oh, no, that's a very good point. I think that'll be a good a key connector between the veteran population and the general civilian population this year, especially. Usually, a lot of I get a lot of thank you for your service, those kind of response. I think a lot of key phrases that people aren't really sure what they mean. They know they're supposed to say them, so they're saying them. And I think this year, unfortunately, many people may have a deeper understanding of the feelings that come along with Memorial Day for a lot of veterans. So that's a really good point. And I think that's
if we could connect the themes of of Memorial Day to our population, I think it'll give us all a chance to mourn, to celebrate, to reflect together. Yes?
Yeah, I agreed.
Okay, thank you.
I will try to figure out a way to do that. If you have any further thoughts on that, I'd welcome an email or a phone call offline later this week or something. So,
Syed, this is Shelby. Respectfully, I'm going to disagree a little bit. I think that as a community, at some point, we need to come together to recognize the impact this has had on all of us and certainly the lives lost. But I think that Memorial Day has a purpose that's specific to people who have served and sacrificed in the line of duty and defending our country for in a number of different ways. So I would just be careful as to how we expand the scope and what we ask Justin and his team to do.
It was established to recognize the soldiers who died during the Civil War. So it really was, right from the very beginning, a veterans focus.
Great. Any other questions for Justin? Thank you, Justin. Appreciate it. Christy, I think you said you had something else in the task force.
Yes. So one of the things that we're doing on the task force is just identifying some needs that we're hearing in the community. So in addition to, looking at basic needs such as food insecurity and issues related to rent and things like that, we've also talked about additional needs that some of the departments and the community organizations are hearing. And one of them is we've heard that people who don't have as much access to the internet or to devices that can get on the internet are just having some difficulties sort of keeping their kids busy and keeping their families busy. And so one of the things that we've talked about in the task force is having arts and crafts drive and like a puzzle swap and a book swap where we could receive items from families and then distribute them to families identified as needing them. So we're working with Westborough Connect specifically on this, but also our library and the recreation department are going to be part of that. And so Westborough Connect has put together sort of an outline of how we might do that, but we wanted to bring it up today to see if the Board of Health specifically or the Board of Selectmen had any suggestions about how that would work. So right now, thank you, Shelby. Yeah, the school department is also working with us on this project. So what they were thinking about doing is having like a puzzle or arts and crafts or a book dropped off at a location in a clear plastic bag with a label saying what's in there, so there would be no need to open it. And then they would sit in a bin and they would be handled with gloves, and you'd be wearing a mask when you're receiving them, whoever's receiving them. And they would be put into a bin for 2 full days before they're distributed out to any of the families. And so we're still working on how that distribution would exactly look, but obviously using social distancing as well as gloves and a mask. But we just wanted to put that out there to make sure that, first of all, you are supportive of that work, but also that to hear if you have any suggestions of how that can be done safely. That's really a question to the Board of Health. So
sorry, I was unmuting my microphone. Yeah, so I mean, I think that there's definitely ways that we can do it, and I think the policies, I think at one point even the library had talked about doing a curbside support before they ended up, stopping services. And I think the Board of Health at that point in time, we were in favor of the library if they wanted to continue to, have stuff that were in bags, minimize any sort of interaction with people. That was fine. So in this sense, I missed a little bit as to you're saying that the task force is going to have books inside of bags and that they would be given out. And I missed exactly how that connected to the lack of infrastructure. So I apologize for that.
So families are just looking for things to do while they're staying home. And so, what we would do is put out, when we're ready, we would put out sort of the word to the community that if you have a puzzle that you've already put together, or, you have books that you're willing to put out there, or arts and crafts supplies, that you would bring them to a location. And they would be in these individual bags, and they'd be held aside for up to 2 days, assuming that that's the right amount of time where the virus would, not continue on that surface. And so that sort of guidance from you, if that's not accurate or if there's additional thoughts that you have on that, would be helpful.
So I think the overall plan is quite reasonable, and it's a good one, and so I'm supportive of it. The issue around how long things need to be not touched is, there isn't a really great answer. You could go with 3 days instead of 2 to be extra safe. I think realistically, a lot of it will depend upon things like temperature, humidity, exposure to sunlight, and things like that. So all those things can affect how long the virus can exist on inanimate objects. But 3 days is pretty much the limit no matter what, even under optimal conditions from the virus's point of view. So you know, if you wanted to be strict, that's what I would do. I think 2 days is probably reasonable, but I would certainly appreciate the input. I know, Nathan, you have, I think, some thoughts on this as well.
Yeah, I mean, I like back when the library was doing it, and they basically had basically 3 or 4 tables, I think it was, and they wanted to do a 4-day process where when things come in, the first thing they do is to put them on the table 1, and then the next day they'd put stuff on table 2, and the third day they put it on table 3, and that only when they got all the way around and they needed that first table again, so that 4 days had gone by, do they actually then pull stuff off from that first table and reuse that or resend that out. And I think that if we've got a place where we can store 4 days worth of stuff, I think that going the extra day is probably a minimal effect for things like a book or a puzzle or something like that. And if it gives us even a little bit more safety, I think that a 4-day window is probably very doable without much more work. Obviously, if the space constriction is a problem, then it might be an issue. But the extra day, I don't think matters too much when it comes to like a book or a puzzle or something like that. I would also agree with Dr. Erlich that it does very much depend on conditions. And I think that some of the more favorable conditions would be something where if a puzzle was wet and then you enclose it inside a sealable plastic bag, you're probably going to have conditions where it's going to survive better than if it was, open to the air and able to dry out, more fully. And so in our effort to, really seal stuff up and make it as sanitary as possible, we may actually be doing ourselves a little bit of a disservice by, making it so that we're sealing it in an environment that might actually be more conducive to it surviving. But I think, as Dr. Erlich said, I mean, the length of time that we're talking about should be sufficient.
One thing, if I can just say in support of what you said, Nathan, at our clinic, where we have the N95 masks, if they've not become contaminated and you're going to take that home, they're advised to just put into standard lunch bags, brown paper lunch bags, so that they can breathe and the air can circulate, and not to be sealed in plastic bags. So that might be an alternative. We're also getting all these brown paper bags from the supermarkets these days, so those are somewhat readily available.
And you can buy those small brown paper bags by the 100 that are like a lunchbox size bag. And I agree with you. It's breathable, and if it's wet, you're going to know it.
My other question was just, where is the task force planning on storing stuff?
So that's something that we're still working out. But like I said, there's multiple town departments involved. So we've talked about, potentially one of the schools, or we could even open the library, because they're not doing the curbside pickup. They're not an essential service. So they're doing a lot online, but they're not doing any in-building work right now.
Yeah, I would say that the library is probably a good place. I might recommend that, because I know in the past during floods and stuff like that, FEMA has actually dedicated libraries as essential services. The ability for people to get books and other materials, FEMA in the past has deemed them as essential. I think that in the midst of this crisis, I think it was our governor who decided that they were not on the essential list, but it might be on one of the things that, as a town, it might be one of the first things that we want to loosen restrictions for when it's a time, and appropriate to loosen restrictions. And so having them already be set up, kind of processing some amount of stuff for the task force, might make it a little bit easier when we actually want to roll out other things that the library might be able to do.
Great. Thank you.
Did anyone else from the Board of Health have questions or comments on that?
I have a question.
Go ahead.
Thank you. I had received a request heard that there were some issues with one of our long-term care facilities, specifically Beaumont, having access to face masks for staff, residents. A little bit confusing in the message I received. I know that Chief Purcell and Steve have been very outspoken about call us if you need anything. I was wondering if they have been in contact with that particular facility or others, if you could give an update on sourcing PPE for those facilities.
Well, sure. Pat, please jump in. There have been a couple that Pat is like the main source for people that need, for companies or long-term care facilities that need supplies. I have directed a few towards him, and I think, Pat, why don't you talk about it? You'd be better off answering it.
I actually don't think that Pat's on.
Okay. All right.
I think he had to respond to a call, so.
Okay, sorry. Well, anyway, so yes, Shelby, sorry.
That's okay.
So I have had a couple requests. We have been trying to fulfill those as needed. I wasn't aware of the Beaumont one, and I had just talked to the nurse, today on that. And I know Pat reached out to them today, and I think they're all set for PPE. And my understanding is PPE for long-term care facilities or other healthcare facilities is flowing pretty good now. People just need to request it through Pat. So if people have questions, they can obviously call me or call Pat directly, and we'll order those supplies for them.
I appreciate you reiterating that message. Again, sometimes these questions come from the community. It may be dated in time, but I think that their website still was asking for PPE. So maybe that just hasn't been updated, but appreciate you making that available.
No problem.
Chief Purcell, sorry, Steve, to kind of echo on that, like we all get emails about people offering masks, gowns, and testing kits. Where should we send those emails to? Is there like a central place that we're collecting them, or what should we do with these offers? Can someone give me some guidance?
Well, go ahead.
I was just going to say, I get a lot of those emails too, and I think a lot of them are, some people are trying to sell that stuff to the town, and certainly, you could forward anything that you think would be useful to Chief Purcell, because he's really coordinating our PPE along with Steve. But he's working directly with the state and MEMA, and so he is getting access, which is why Steve and Chief Purcell are the right resource for the community. But I guess I would also want to add that if it's someone who's volunteering to make facial coverings, the task force in coordination with Westborough Connects is working on making facial coverings just available in general to the community. We're identifying locations where people can go and just pick up a mask that's been donated to the community. So there are several groups who are working with Westborough Connects to do that work. There's also just individuals, I think we all know them, that are making lots of masks in their home and are willing to share them with the community. And so we're trying to work on those types of locations where people can drop off and pick up that kind of mask.
So do you know so with regards to the masks that people are making that are going to be available to the community, so that's a process underway and will be communicated to the residents at some future point? Would that be correct, Christy?
Yep, I actually think it's pretty close to happening if it hasn't already. I know that Westborough Connects is working directly with the police department to have a drop-off location there. So they are collecting the masks. Actually, the masks that they'll have there, I think, are the disposable masks. But we also know that people are making masks. There's a drop-off bin at the senior center right now. So if you make masks, you can drop them at the senior center if no one's there to take them. They're washing them, drying them, putting them into individual plastic bags and making them available to people that they know are in need of them.
And I would add that anyone that is in need of a mask can contact our central resource line that was just established. Yep. So if you don't have a mask, call that number, and it's 508-877-5111. No, I said that wrong. Sorry, I don't have it written down.
Maybe we can send this as one of our blast emails, because I'm not sure that people.
Well, Chief Purcell spoke to his announcement, but Christy, could you repeat the number, please? Sorry.
Yep, it's 871-5111.
Thank you.
Steve, I would request that when we make our when we make the advisory that we had a motion on earlier today about people wearing masks in supermarkets and whatnot, when we issue a press release about this or announcement, that the information that we just spoke of be addended at the end of that for people who want to know how to get a mask, that that information be provided, if that's okay with you.
Yeah, I'll work with Christy on that.
Yep, that sounds good. I would, based on Syed's question about what to do when people are calling and offering, free test kits and stuff like that, there's obviously a little bit of fraud that might be going around right now. And so I just want everyone to have a little dose of skepticism when people are saying things like, oh, I've got a whole bunch of, test kits that I'm going to provide to you. Either they're making money one way or the other, or it would be really rare for someone to actually have testing kits that are that they got somehow and that they're now not using and are giving away. So that to me just strikes me as something that we should be looking at a little closer. I've also heard reports of people calling as if they were belonging to a contact tracing group run either through the Board of Health or through the Massachusetts contact tracing program, where people are trying to get social security numbers or personal like financial information. And I just want to put it out there that if the Board of Health or the someone that we're working with is out to do contact tracing, we will not ask for social security numbers. We will not ask for financial information. And if you do end up getting a call from someone and they are asking for that information, that should be forwarded to the police and the Attorney General, because people should not be asking for your social security number when they're doing contact tracing. So in this sort of environment of COVID-19, there's a lot of people out there looking to try to scam you. And I just am trying to prepare our citizens for the fact that there have been reported cases in Massachusetts of this happening.
Thank you, Dr. Walsh, for that. Anything else for the joint meeting here?
I am good. Dr. Erlich or Dr. Hashmi, do you have anything?
No other issues for me.
No, none for me. I think just as a summary, that, again, I think a lot of people listen to Chief Purcell's message, and I think in his message from last week, he mentioned that that we are still available. That if you have issues, go seek appropriate medical. I think the way he phrased it was very good, and I would just encourage him to continue to do that. I think people, if they're in trouble, they need to contact their healthcare provider.
Good. So with that, I'd love to turn it back over to you, Mr. Johnson.
Very good. I don't know if you need to adjourn your meeting or if you guys.
Yeah, we might as well take a vote to adjourn our meeting, and I think we've got it. So the next meeting would be for next Tuesday. So
I move we adjourn.
Do we have a second?
I'll second that. Hashmi seconds.
Okay. Dr. Erlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh, yes. All yours, Ian.
Great. Well, thank you. And thank you as always.
Yes.
It's great. I know that we've received tremendous support from the community, just really thanking us for these joint meetings. And so appreciate you guys working with us and continue to work with us. And once again, to Steve and to your staff, this is yeoman's work that you guys are doing and very, very much appreciated. So thank you for that.
I'd also love to take credit for our board, but it really is the director and the people that actually work for the board that actually do all the hard work. And so, yes, your appreciation is noted for them. Thank you.
Perfect. Thanks. Okay, so I'm going to jump back into the agenda for the Board of Selectmen now. For our board, we have a number of meeting minutes. What I'm going to suggest here is that I'll read through them. If I'd like to do kind of a consent agenda that we all those that we don't have questions, that we just approve them in bulk. But as I go through, if any of the board members have a question or comment, just call out that one. We'll come back to it. Similar to how we do things with budgets and whatnot, that we'll vote those that are unquestioned, and then we can go back and vote the other ones. So if hopefully folks are fine with that, and hopefully it works. Maybe we'll have a question on every one, and then we'll just go back to the beginning. But anyways, first set of minutes, January 30th, 2020. Any questions on that one? Hearing none. February 5th, 2020. February 11th, 2020. February 25th, 2020. March 10th, 2020. March 12th. March 31st. April 7th.
Ian, I did have a question on, but you went so fast, on February 11. That was all.
Okay.
Mark Silverberg commented on the acoustics in the Great Hall, and the way it's written in the minutes is that he just commented on it in Forbes. And I think if we just list somebody made a comment when actually he had a pretty firm criticism that the acoustics were lousy, that needs to be recorded. That is something that we're concerned about, the acoustics in large meetings. And I think Christy's already aware of that, and I think she and some other people are starting to consider what they might do, although with COVID virus is sort of low on the list. But we have a lot of people who go to those meetings and complain about how difficult it is to hold a meeting with the acoustics. So I don't want to lose that kind of detail and just have a summary. Somebody commented on it.
I'm just trying to find it.
Yeah. I think I can't remember if it's under issues and correspondence. That meeting, we had the joint meeting with the planning board.
If I may, it's on page 6.
Oh, thanks. Thanks very much, Sheila.
No worries. It's under the follow-up budget meeting on January 30th. Mr. Silverberg's comment was at the very last bullet point on that one.
Okay.
Good.
So if you have that, I think if we just make comments about audiovisual equipment in the Great Hall at Forbes Municipal and the need for improvements.
Received.
Thank you. Anything else? I didn't hear any other comments. If not, I would take a motion to approve the minutes as read.
I would move that we approve the minutes as read with that one edit on the February 11th meeting.
Second.
Okay, moving second. Any follow-up comments, questions? If not, roll call vote. Selectman Emery?
Yes.
Selectman Edinburgh?
Yes.
Selectman Marshall?
Yes.
Selectman Hashmi?
Yes.
And Selectman Johnson, yes. Thank you. Okay, next on the agenda is, and welcome, an introduction of our new Conservation Director, Jordan McCarron. So, Chrissy, I don't know if you want to do an initial introduction, and I know Jordan, I see him on, and he can talk to us. And
so Jordan actually comes to us from the town of Lexington, and he started on April 7th, I believe, in the middle of this whole pandemic. So we've all met him virtually, but not many have met him in person. And so he's working very closely with Sherry, who was outstanding as our interim conservation director. And so the two, she and Jordan and the rest of the commission are really getting Jordan up to speed, and we all look forward to meeting him in person. So, but I'll let him speak.
Great. Thank you, Christy. Good evening, everyone. Nice to be here with you, so to speak.
Welcome.
Welcome.
Thanks a lot. Yeah. Well, certainly a strange and surreal circumstance to be formally introduced to you all. And I suppose the only silver lining may be that from the comfort of my home here, I can kind of read my notes and come across as a little more eloquent than I probably am in real life. So I just wanted to thank you first for the opportunity to introduce myself. And I'm going to talk a little bit about my background and qualifications, and I'll definitely keep it brief. And incidentally, here for me is the town of Maynard generally, and my kitchen more specifically. So I started, as Christy said, on April 6th, which was about 1 month ago. And simultaneously, it feels like much shorter and much longer than that. As Christy said, I come to Westborough from Lexington, where I spent 6 years working as the conservation land manager for the Department of Land Use, Health and Development. The structure of the government in Lexington is a little different than Westborough, and certainly I'm getting to know how Westborough works. My primary focus in Lexington was the development of a comprehensive land stewardship program on roughly 1,300 acres of municipal conservation land. Lexington is different than Westborough in one big sense. We don't have a land trust or any other entity that kind of manages open space. So there's more municipal conservation land in that town. And I mentioned this in the introduction that I sent to Christy for her town manager's report this week, but running this land management program required careful planning and understanding of how to simultaneously protect our natural resources, as well as make them accessible to the public, which is hugely important to me. Creative approaches to funding, obviously, as well as an ability to engage the public. That was one of my, I think, probably one of my stronger skills was, for example, getting volunteers, working with the community and engaging them in the work that a municipal conservation department does. This job in Westborough, frankly, is really the first opportunity for me to work in a director role. And though I certainly have a lot to learn about Westborough, this new job appears to present for me a pretty rewarding combination of challenges. First, I have the opportunity to cut my teeth, so to speak, on the regulatory and statutory responsibilities of a conservation office. And what, at least as an outsider looking in, what appears to be a very dynamic town. There's a lot of commercial development, obviously, a lot of residential cluster development, 3 major state highways that come through Westborough, and all of this occurring in pretty close proximity to a lot of wetland sensitive areas, and of course the ACEC. And at the same time, I feel that this is an opportunity for me to grow the expertise that I've gained and really test my knowledge in the area of natural resource management. And what I hope to do, and I've talked to the commission a little bit about this, and I think this is probably one of the primary drivers for you all bringing me on, is to build in Westborough the type of municipal land management program that I'm very proud to have built in Lexington. So on that note, I thought I might close this short introduction by just offering a little bit of my perspective on what my role is as an agent of the Conservation Commission. First and foremost, I believe my role is to provide the Commission with as much information as I can, to ensure that the right process is followed, to lend my expertise and perspective, when it's asked for, so that the Commission can make informed decisions based on facts and evidence. Ultimately, though, and this is, I believe in this strongly, and it's how we worked, in the previous town in Lexington, and I really believe in this kind of philosophy. Sorry. But ultimately, you as the Board of Selectmen have appointed the Commission to uphold the state's and Westborough's wetland laws, to help set good environmental policy, to take ownership over the town's conservation land. And it's really the Commission who votes and whose reputation is on the line when they do so. And, I have a lot of respect for that. And so it'll be my goal, certainly as a new director, to keep them well informed and really involve them in as much of the activities of our office as is practical and as they want. So with that, I'll say again, it's great to be here, and I look forward to working for and with you all and meeting you all in person whenever that day and that opportunity can come.
Great, Jordan. Thank you very much. I open up to the board. First and foremost, everyone else to say welcome, but any questions anybody has for Jordan?
I don't have any questions. I think your presentation about yourself and what you think your role is was quite informative, and I agree with the things that you're saying. And it's interesting that you're bringing a slightly different set of skills, or maybe vastly different set of skills, but certainly a different orientation to the position, which isn't that old a position really in its modern form. It was kind of an anachronistic position before Derek took it over. And Derek was very busy with an awful lot of on the ground things that had to happen. And now we have this wonderful Sherry that he trained, and she can do an awful lot of that on the ground. And I think like having our new director of DPW who can look at longer range strategic planning and larger issues brought to the conservation director and available to the Conservation Commission, DPW, and the town is going to be an enhancement of that position. This is Lee Emery. So I've been on the board for like 17 years. So I appreciate very much what it sounds like you're bringing to us. Thank you.
Thank you, Lee. That's great. I've got to know Derek a little and have done some, site visits at some of the project sites that the DPW is working on, obviously at a safe social distance from him. He did an incredible amount of work as the conservation director. And I think he saw a real need for that kind of work in Westborough. And I think he would agree, and I would argue that the type of work that he did before, which was really more focused on the infrastructure, like the stormwater and the drainage infrastructure of Westborough, is really work that a public works department would do, not necessarily a conservation department. And so I look forward to working on those type of projects with him from more of a sort of, let's say, an advisory or from the kind of the permitting side of that type of work, and be able to work with the commission to focus on really the management of the town's open spaces.
Jordan, this is Shelby Marshall. So great intro. Want to echo everything that Lee said. And I'm just really excited to hear your perspectives. Just the last one you shared about that interplay between DPW and a lot of the work that was previously done by our director. And just to see how those play together, how things change, and how you certainly complement and bring your own flair. So welcome aboard. And we do look forward. I don't think you're an avatar. I think you're a real person. So look forward to actually seeing you in person at some future date.
Thank you, Shelby. Nice to meet you.
This is Selectman Alan Edinburgh. I'll just, ditto on the comments from Lee and Shelby, and just welcome aboard and look forward to working with you as we go forward.
Thanks, Alan. Nice to meet you.
Great. Well, Jordan, thank you very much and welcome. And apologies that your starting date was at a very interesting time, and that we're doing this virtually. But we definitely look forward to, as the rest of the board said, really the insights you bring, and I think the kind of switch in roles and responsibilities. I think with you coming in new with a new DPW director and our old conservation director moving into the assistance role over there and pulling a lot of the stuff. I think you've probably had this conversation with Derek, but I think he's in agreement that a lot of that stuff that he was doing properly belongs in the Public Works Department, and he's probably the best one to now continue that and work closely with you in your role. Have the work that they're doing be in the right place now. So.
Yeah, and if I may, I just want to acknowledge, Christy, you touched on this, and Jordan, you did as well, but I do want to acknowledge the great work done by Sherry Wittes to sort of hold everything in place as she was the interim director. And it's great that she continues on in her role as a teammate of the conservation team. So just want to acknowledge the great work that she's done.
Thank you for that, Shelby.
I would echo that as well. Thanks, Shelby.
Well, great. Well, Jordan, thank you.
Thank you, guys. Yeah, have a good night.
Yeah, you too.
Thank you.
Okay, Christy, turn to you. Next thing on our agenda is the discussion vote on exercising the town's right of first refusal for 31 Moses Wheelock Lane.
Yep. So the current owners of 31 Moses Wheelock Lane want to put it up for sale. It's an affordable unit, so the town has a right of first refusal. And so we would just need the board to waive that right of first refusal, understanding that they would be working with DHCD to continue to sell it as an affordable unit. And DHCD would come back to us if they were unable to. So I put a draft letter, and it's similar to a letter we've drafted in the past for this type of transaction.
Chris, I was going to say, appreciate that explanation, Chris. I think every time these come up, I know I always need a refresher of what does this mean, and I think it's important that you made the point that this will be continue to be affordable. If not, we would be brought back into the loop. So thank you. I'd like to make a motion. I move not to exercise the town's right of first refusal for 31 Moses Wheelock Lane at this time.
I second the motion.
Seconded by Selectman Emery. She got in before you.
She did.
He has his heart in the right place too, because he wants to keep that affordable housing on the market.
Absolutely. Any further comments or questions? Okay, if not, it will roll call vote. Selectman Emery?
Yes.
Selectman Edinburgh?
Yes.
Selectman Hashmi?
Yes.
Selectman Marshall?
Yes.
And Selectman Johnson, yes. So it's 5-0. Great. Going to keep it with you, Chris. The next thing on our agenda is discussion vote to extend the contract with the town's municipal aggregation consultant, Peregrine Energy Group.
Yep. So the Peregrine Energy Group is who we're currently using for the municipal aggregation. Some of you have worked with them as we've looked at extending the aggregation program that's coming up. The contract is expiring in May, but there's two options for 1-year extensions. And so, we've had a great relationship with Peregrine, and we also have worked with them already related to Sustainable Westborough and their interest in educating the community about the default green energy option and how that would work. They've also been they've been a big proponent in signing on to legislation that will stop some of this reaching out of all of these companies that are saying that they're part of the aggregation, and sort of the concerns that we've shared about people being kind of roped into supply contracts and then having escalated costs. So they're watching that as well. So I would like the board to vote to extend their contract for the 1-year extension.
I'll make the motion. I move to extend the contract between the town and Peregrine Energy Group for 1 year.
Second.
Second by Emery. Any further comments or questions?
Nope.
Okay, if not, roll call vote. Selectman Emery?
Yes.
Selectman Edinburgh?
Yes.
Selectman Marshall?
Yes.
Selectman Hashmi?
Yes.
Selectman Johnson, yes. So 5-0. Okay, moving right along. Discussion vote to amend the vacation and personal day sections of the personnel policies. Chris, put it back to you again.
Sure. So the non-union employees operate under the personnel policies, and currently they are permitted to carry over up to 1 week of vacation time on their anniversary. And also they receive personal days on July 1st, but there is no carryover permitted for personal time. In light of everything going on with the state of emergency, the inability to travel, sort of the need to be working remotely, we're just asking that the board would consider allowing non-union employees to carry over up to 2 weeks of vacation time and up to 2 personal days. So your vote tonight would be only on the non-union staff, understanding that we would be working with the union staff with the same.
Mr. Chair?
Yes.
I move to allow non-union employees to carry over up to 2 weeks of vacation time for anniversaries occurring between March 15, 2020 and March 14, 2021, and to further to all non-union employees to carry up to 2 days of personal time on July 1, 2020.
Is there a second for that? Okay, second by Selectman Edinburgh. Just to be clear, for folks, so right now in the personnel policies, we do allow for non-union employees who are covered by the personnel policies, we do allow for 1 week of vacation time to be rolled over and no days of personal time. So what this is doing is for this year, because of the situation we're in, adding an additional week of vacation time and the 2 personal days. Any other further comments or questions from the board?
I'm sorry, Ian, just to be clear, we're not adding time, we're just allowing that additional carryover.
Yes.
Unused time.
Unused time, yes. If we're not giving him additional, it's unused. Yes, thank you for that. I spoke, so appreciate you clarifying this. Okay, if not, all those in favor, Selectman Marshall?
Yes.
Selectman Edinburgh?
Yes.
Selectman Hashmi? Selectman Emery?
Yes.
Selectman Johnson, yes. So 5-0. Okay, next on the agenda is discussion vote to authorize the town manager and police and fire chiefs to apply for a grant for consulting services to consider the feasibility of a regional dispatch center.
Right. So we have both chiefs on the call with us, and I'm going to let Chief Purcell discuss sort of what the regional dispatch center would look like and what the grant is that we would be applying for, if he is back on the call.
I do not see him on there.
Okay.
Can we come back to this agenda item?
Yeah.
Sure. You said he was called away, Christy?
Yeah.
Would it be helpful to have Chief Laurie make a statement now about it and then Pat add to it after?
Actually, why don't we, if it's okay, why don't we move to Chief Laurie's agenda item, which is the police department budget?
Yep, perfect. I'll do that. So we'll chairman's prerogative, but to select the town manager. So we'll move to item 10 on our agenda. So Jeff, if you're prepared,
I am prepared.
Okay.
So I promise to be brief. It's been a very long day, but just to briefly go over, originally the several meetings that we all attended with finance as well, we were originally to hire 3 people through the staffing study. Originally, 1 was going to be for July 1st and then 2 in January. We decided it would be easier for us to train these bodies all at once, so we picked the date of September 1st. Then, due to budgetary constraints, we decided we're going to move them to October 1st. A week almost, we were almost at town meeting, and here we are. So we were asked to make cuts. So the deputy chief and I took a hard line look at the budget, and we reduced the budget by $104,209. That's eliminating 2 positions at this point and all related costs associated with them. Their clothing allowance, psychological exams, physicals, health incentives, etc. We decided at that point, we have someone that worked for us. He wants to come back to work for us. He's a perfect fit for the Westborough Police Department. And he was basically a 3-year employee. And we decided that we'd like to put him in for July 1st. And the reason why, with everything going on. Right now, the agency is healthy. We're all working. But at any time, I could lose several officers. This individual would be a complete plug and play. He would start July 1st, especially when people are going to be taking time off because people are going to be carrying some extra time over, as we just heard. He'll be able to handle some of that to negate some overtime. The other factor is we're going to be losing an officer to the military for a year. So again, we're playing catch up moving forward. So we really felt that by bringing him in July would be a benefit, dealing with overtime, vacation time. And right now, for instance, our FTO program, I mean, this is uncharted waters. I have an officer that's being followed by his FTO, and they're on speakerphone. So this is an individual where the field training program, he would just hit the ground running. Basically, July 1, I put him in a cruiser and he's back to work. So I know there were some questions by the board. I get it, faceless positions, to cut. But there is a face with this one. He'll be a huge asset to the department. And my fear is, quite frankly, tomorrow, the Southborough Fire Department, I mean, they lost 9 people and their chief. These things can happen. And we're dealing with people on a daily basis. We had a very busy day again today. where we really do need tires that meet the road. And I've been playing catch up since taking over, believe it or not, coming on 2.5 years ago. This is obviously going to slide us back a little bit, and I understand that. And whatever is decided by the board, by finance, and by town meeting, we're going to do the best with what we have. And I've got a great staff. Morale's high. Things are going very well. We're doing the best we can with what we have. But, this is bad. They're saying possibly, potentially in the fall, that it could be worse than it is now. And I need officers on the road. And we have plans in place if people go down. But this officer would be a huge benefit. And that's why I was pushing for the July 1 date, if it's at all possible. And I appreciate the opportunity to address your concerns.
Great, thank you, Chief. And just for clarification, the $104,000 you talked about, that factors in the removal of those 2 additional bodies, but the slight increase in cost of moving from the 1 body from October 1st to July 1st. That's a net number than the 104.
Yep, the total is $104,209.
Okay, thank you.
From personnel.
Basically 2 bodies and any costs related to them coming on from the expense side. So it would be salary and then any expenses related to those two hires. And like I said, I don't need a psychological. I don't need any of that with this other officer. We've already done it.
If I understand correctly, you indicated this is a patrol position?
Correct.
Okay.
Patrol officer.
And you mentioned that we have an officer who will be serving with the U.S. military for a year. When does that start?
Right now, December. He leaves in December.
Okay, so July 1st.
But he could be leaving any time. I don't know. I could lose him tomorrow.
Well, understood. And it gives this new officer time to get back into the routine and integrated with the operations and the staff. Okay, thank you.
Correct. Yes.
I have a question. Chief Lowry, when an officer goes off to a military assignment like that, do we still carry his salary, or is that picked up by the military and then he comes back and we pick up his salary?
The only thing that, Lee, that's a great question. The only thing that we pick up is the difference. So usually there's a slight difference where they may make a little bit more as a police officer. He's a ranking officer, so his military salary is a little higher. So there would be a potential salary savings there.
Thank you.
For 6 months.
Christy, I'm curious. Thank you, Chief Lowry, for your presentation. This is Shelby. Christy, has AFC Finance Committee provided some thoughts on this?
No, we have not met with AFC. I believe they're meeting next week, and Leah Talbot and I will be meeting with them. I was waiting for sort of final numbers and to see what the school department will be coming up with to bring this back to this board. But I would add that following your last meeting, we identified an additional $51,000 cut in the DPW. And then we also identified a $4,000 cut in the Historic Commission.
Ian, may I?
Yes.
I was really on the fence about this before, and I think your original suggestion, Ian, that we put a hold on all hires right now, given the uncertainty of so many things, was good advice. So part of me still thinks that's good advice. On the other hand, I think Chief Lowry's concern about losing officers is totally valid. We know the more you read the newspaper, whatever good source of information you have, you realize people fall very quickly and unexpectedly, and then all of a sudden you're in a place that you never thought you'd be. It's interesting they had so much trouble with folks in Southborough. So I am thinking that it probably is a good idea to bring somebody on board, even though it's a little earlier than we wanted, because of their background and because they can step right in, and because you're going to be losing this other officer maybe sooner than you think to the armed services. And we do need to stay not even fully staffed, because it isn't what your study said you really needed, but we need to keep a stable staff. So at this point, I would be in favor of bringing this new officer on, where before I really felt I was on the fence about it.
Thank you, Lee. No, I would just add that I did bring this up at our last meeting in the question, and it really was an opportunity for the chief to come before us tonight to really talk about the rationale for this, because it's easy to say, hey, and I think as Chief Laurie mentioned, that that when you don't have kind of faces to names, but I do think that the needs that are there that he's outlined, in my mind, justify bringing that position to a July 1st hire. So I am supportive of the request as well to move that to July 1st. I guess the only caveat I'll have in there, and this is something, Chief, that is out there, is it's all dependent on us getting our town meeting in time, and if we are not able to do that, it may need to get slightly pushed back. Hopefully that doesn't happen. Fingers crossed and optimistic that we'll get a town meeting in June, as we're hoping for, but there is that slight risk that if for some reason we can't, we'll go on a kind of a interim budget, 1/12 budget until we can get town meeting. But again, just something to have in the back of your mind, but hopefully that's not the case and we are able to bring this through town meeting.
I totally understand. Thank you, sir.
Thanks.
Totally understand.
Great. Anything else from the board or any other questions?
So this was just a discussion, so it'll come back to you for a vote at a later time when we have a more finalized budget.
Perfect. I did see that Chief Purcell joined back in, so with both the chiefs here now, we'll jump back to the earlier item on the regional dispatch center and the grant opportunity there. So, Chief, welcome back. Thank you.
Thanks. Sorry, I had to step away.
No problem.
Chief Purcell came to me a couple weeks ago and to talk about the opportunity for grant funding to look at a potential regional dispatch center. This is not a new concept to Westborough. It's something that we've considered in the past. And so we got on a call a couple weeks ago, or a week or so ago, with some other town managers in neighboring towns to see, who might be interested in exploring this with us. And we do know that the town of Shrewsbury is also going to consider this grant with us. So I'll let you go, Pat.
All right, thanks. So this is something that we actually started talking about when Jim Malloy was still the town manager. And really at the time, it was bad timing to bring it forward. There wasn't the same grant opportunities that are available now. And the town manager and I did a lot of research through State 911, and it seems almost too good to be true. However, this is consistent about what's going on. And where it starts from is every city and town in the Commonwealth was afforded a public safety answering point, also known as a PSAP. And they quickly learned that there wasn't one that was required in every town. And I'll give you for instance, in the state of California, they have about 3. And in Massachusetts, we have over 300. So the opportunity that presents itself is something that is long-term. It is driven by statute. It's not going away. And if you ever looked at your cell phone bill, you'll see an assessment charge. And everybody through their carrier gets that charge, and that goes direct into State 911. It can't legally be, you can't rob Peter to pay Paul. So the state can't take that money for something else. It has to go there. And they fund grant opportunities often. We historically, with the police and fire, whoever has managed that center has taken advantage of those in small amounts, typically less than 100,000. But right now there is a grant opportunity to explore, which is why I'm here tonight, to explore an opportunity for a regional dispatch center. So I'm before you tonight to ask for permission to, which I have written. And if you say yes, the manager and I can sign, or she can sign a letter of attestation, and we can combine that with the grant and hand deliver it to State 911. And what the first part of this grant for is a non-committal up to $75,000 to hire a consultant. I've already been in contact with several, and we could hire one, again, no expense to the town of Westborough, to see if it's feasible. I can tell you that it is. The opportunities that presented through this grant long term are unbelievable, in my opinion. It would resolve a lot of capital liability that we have, OPEB, insurance, pension contributions, capital projects extending beyond the dispatch center into communications infrastructure at police and fire, and beyond the first $75,000 that we're prepared to apply for, we would be reapplying for the second portion in about February or March of next year, in the tune of millions. And they will fund everything from the repurposement of a municipal building that exists already to purchasing another building or building a structure. And they pay for all of the communications hardware and infrastructure that would go into that center. There are some staffing contributions that they make. If you can go to the next slide, Christy.
Yep.
So if you look at the state 911 funds the following. So throughout the project, they'll fund consultants, project management, a building, equipment, the hiring of a director and a deputy director for that division, supervisors, and those two are initial training. At some point, they would be absorbed by that center. Initial training and for all employees, radio towers, and they also right now are offering a transition award. So let's say that we write the grant, the consultant writes the report, we like what they have to say, and we move forward to the next part. The day that we transition over to a regional center, if there's there will be an assessment per community that's involved in the center. It's usually for what we're planning on doing somewhere around $300,000 a year, which is significantly less than the cost of the operation now. The transition award would pay that assessment for 3 years, 100%, year 4, 50%, year 5, 25%, then when we would take over. So that's just at the onset. And as I alluded to earlier, the annual benefits are capital, straight through that center, police and fire, capital for infrastructure, all the training that's required in the center. They still provide a support and incentive grant. They still provide emergency medical dispatch, the fees associated with that. And they also do two more things. So the grants that we usually take advantage of, we get bumped up into another tier. It's called a REC grant, or a Regional Emergency Communication Center grant. And that is where a lot of the money to run the center comes from. And also combined in that center is a wireless incentive, which we do take advantage of right now. So by capturing wireless calls for any community that's involved, they give you extra money on top of that. So I'm merely estimating right now, but I would say that the amount of money that if this becomes fruition, that center, dispatch center, would gain annually is probably around $800,000, and then the assessment per community, I just think it's a smart move. Can you go to the next slide? So again, I guess what we're looking for is permission tonight just for the letter of attestation that the town manager would have to sign. And then once that's signed, we would obviously follow procurement laws and move forward to get the appropriate project management and or consultant people on board with us just to study it, and then provide a report back sometime in the fall. And if that is something that the board and the town manager were happy with, then I would start working on that grant for February, March for the several $1 million, probably $4 to $5 million to make this happen.
So we know that this hasn't come before you before, and we're asking for a quick sort of turnaround on the decision to allow me to execute documents related to this grant. But I think the thing that the chief and Chief Laurie, we've also talked to him as well about this. And so I think the thing we want to stress is that this doesn't commit us to anything, except for if we were to get the grant money, we would be committed to having a consultant come and help us look at the feasibility of the regional dispatch center.
Again, yeah, just to repeat that, you don't like what the report says, we're out.
I have a question.
I have a question as well.
Yeah.
Okay.
I think I'm understanding it, but I might not be. If this all came to fruition, does this mean that we would have a regional call center and all of the dispatchers that are now in the fire department would actually be in a different centralized facility and they'd be taking calls for Shrewsbury and Westborough at a minimum? And in some way, are you thinking that that would improve our response time? You sound like it might cost us less, but is that what would happen? And do you think what kind of an effect do you think it would have on responses?
I don't think it would have an effect at all on our response times in our own town for our own department, but it would certainly streamline efficiencies when we're receiving automatic aid or mutual aid from other departments because they're all in the same room. So there's a lot of detail that goes into this. This is why hiring the right project management team and the right consultant is very important out of the gate. They wouldn't be, the people that work in the center would not be employees of the town of Westborough. We would probably petition the Commonwealth to start a dispatch district, and they would operate out of that room, out of their own building. So if you've been in our station, you see the station alerting on the walls here that alerts us to a call that the dispatchers use. That would be in every firehouse in any of the towns that are part of the center. So you would not see a delay at all. I think we'd actually more efficiently with the other towns that we work with be quicker.
And is this important, Chief, because we're at the confluence of 495 and 20 and 9, and we get a lot of calls from mutual aid? Is that part of the
we work with each
appeal
other.
of this?
We work between Shrewsbury, Northborough, Southborough, Hopkinton. We probably work with them half a dozen times a week, at least.
Thank you.
Great. Alan, you had a question?
Yeah, I was just asking if you have a sense of which communities. I know you mentioned Shrewsbury, Northborough, Southborough, and Hopkinton. Are there other adjoining communities that might be interested in this?
Yes. I believe we've spoken with Hopkinton, and we just haven't got a commitment back from them, so it's probably not fair. We talked to Southborough. They showed up to meet with us in Hopkinton. And I believe that there's other towns that the manager is going to reach out to. Well, I'll let her talk about that.
No, it's okay. So we just need at least 2 communities for the grant application, and we know that Shrewsbury Board of Selectmen is considering this exact same action tonight. And so we know that Westborough, assuming that both boards vote to support it, we know that those 2 communities will apply for the grant. But my understanding from the chief's conversations with State 911 is that other communities can become a part of this at any time after.
Absolutely.
And we certainly wouldn't. We don't have an intention to limit it at this point. I mean, we've reached out. So.
Point of clarification: if Shrewsbury and Westborough are both applying for that, are they applying for it to ultimately both of them be the lead, or they're applying to work together?
So I'm applying to be the lead. They are not applying. All they are providing is the letter of attestation.
Okay, thank you.
Welcome.
I guess my question was similar to Lee's, but with both chiefs here, it sounds like the cost saving on one side, but I guess the potential concern was in terms of anything that we may lose out on as a community, et cetera. It sounds like from what the response was that it's as good, if not potentially better, because of the mutual aid. But is there anything that we're not seeing here? I guess what's the downside, if any?
So the downside falls when you don't enact the right form of governance and you're not transparent and open with everybody. I've called a lot of different centers that have already been established or tried to establish, and they felt like when there wasn't full transparency and everybody wasn't on the same page, they actually had division within the room and they failed. The people that had full transparency and worked well together, which the players that we have talked to, we work well with all the time, are very open and very, very honest with each other. So as long as we can prevent those things from happening and we build a good center, then people are going to want to come.
Perfect. Thank you.
But I think we also feel that the feasibility study will also, highlight the benefits and any other considerations for going forward.
Yep.
Perfect. And Chief Laura, I guess a question to you. In some ways, you're somewhat almost operating a regional center now within Westborough, where we made the move and they sit in the fire station now. But any comments?
Yeah, and you're absolutely right. In essence, we are. We really are. And quite frankly, one of the missions with these three hires, was to staff the station. And that's going to be an issue that other agencies that have a dispatch center, in their headquarters are going to have to deal with. We're dealing with it now. And eventually we'll get there when this ends, hopefully. But for all intents and purposes right now, you're correct. When my building goes dark, because of this pandemic, it'll continue to go dark at times. I won't be able to have an officer in there, and hopefully the public will understand that. But honestly, you hit the nail on the head. We're regional right now, even though it's just on Milk Street. It's not far away, but they're not in our building. So we've put parameters in place that other communities are going to have to do. If this moves forward, I think the discussion should take place. And hopefully you'll support Chief Purcell's initiative to research this further.
Great, thank you. Anything else? Everyone want to make a motion?
I'll make a motion.
I will. Oh, go ahead, Lee.
No, go ahead.
Sorry.
Nope, you got it.
I move to support the application of the state 911 grant for the purpose of hiring a consultant to evaluate the feasibility of a regional dispatch center as presented.
Can you add to that and further to authorize the town manager to execute any documents related thereto?
And further to authorize the town manager to execute any documents related thereto.
Thank you.
Second.
Okay, second by Selectman Emery. Any further comments?
I continue to be amazed at Pat's and Chief Lowry's imagination and curiosity and go-to-itiveness. It's really amazing.
No, I agree. Anyways, roll call vote. Selectman Emery.
Yes.
Selectman Marshall.
Yes.
Selectman Edinburgh.
Yes.
Selectman Hashmi.
Yes.
And Selectman Johnson, yes. So 5-0. Good luck, and we look forward to you getting the grant, hiring the consulting, and seeing the results of that study.
I appreciate you trusting us very much. Thank you.
Thank you.
Good night, everyone.
Thanks. It should be a pretty quick one. This is to the discussion vote to designate a public safety official to submit a report to the Attorney General that sets forth the reasons why the declaration to postpone the annual town meeting was made per Mass General Law, Chapter 39, Section 10A. So we did this once before, where we used Chief Purcell to do that. I think that's makes sense to do that again. But Christy, anything you want to add there?
I just recommended Chief Purcell as your emergency management director, and he's already prepared the report, so he'll send that as soon as he's designated. But under the law, you have to designate within 10 days of the declaration. So
I move to designate Chief Purcell to report to the Attorney General the reasons why the annual town meeting was postponed.
A second.
It's seconded by Selectman Edinburgh. Any further questions on that one? Okay. If not, roll call vote. Selectman Edinburgh?
Yes.
Selectman Hashmi?
Yes.
Selectman Emery?
Yes.
Selectman Marshall?
Yes.
And Selectman Johnson, yes. So thank you, Chief Purcell. Okay, next on the agenda is town meeting warrant review. Back to you, Christy.
Yeah. So I worked with the staff to go through the town meeting warrant to talk about which items we might take up in June and which we would take up in October. We've actually just finalized that today, so I will forward the document to you, but for now I can just share my screen as we go through the warrant.
And Christy, you're probably going to, but just for the public's benefit, can you explain the June, October?
Yep. So currently, even though we've postponed the town meeting to May 21st, that's because the law only allows the moderator to postpone for up to 30 days at a time. During your last meeting, we had discussion about when we expected the annual town meeting to take place. And at this time, we're expecting it to take place on June 20th, 2020. And so that would be the moderator's next declaration that we expect. And so the October town meeting obviously is when we typically hold our fall town meeting. But we had discussions about what warrant articles and what items might be held until the October town meeting. We have a better idea of the possibility of a resurgence, what our finances might look like, and then some things that just made sense based on our inability to meet in March to push something maybe to October. And so you'll see here I have four.
Can you make that bigger? I know it's hard for me to see. The public may
Sure.
have. Yeah, thanks.
Yes, please, bigger.
So this is just a recommendation, and certainly I think there's more work to be done. Why is that not?
You hit Zoom, yeah.
Yeah. Oh. Okay. Might be too big.
Much better.
Okay. So in the first column, you'll see that the subject of the town meeting article. The second column is the articles that we would recommend continue in June. And then if there's an appropriation, we put the appropriation amount. And then ones that could be deferred to October would be in that column. And then the funding sources at the far column. So obviously the town elections and town report have no appropriation, and it would remain in June. The prior year bill is something that we would need to authorize. So it's $3,700, and that's a free cash appropriation. Obviously the fiscal 21 budget we're still finalizing. In addition to some of the things I mentioned earlier, we are also waiting on the borrow that we anticipate doing next month, and that will inform the debt budget for FY21. Under the regularly recurring articles, we have reserve funds. So that's a free cash. It also comes from retained earnings for water and sewer. The restocking of Sandra Pond is a free cash, which we're proposing in June. Tuition reimbursement, that's for the next fiscal year. So we would want that set up as early as we could in June. The cable TV budget, the same thing. That would be something that we would want to appropriate in June. The 4th of July block party, I'm still waiting to hear. I've heard that there's informal conversation about whether or not we're going to be able to have that. And so right now I've pushed it to October, but I'm waiting to hear back from that committee. The Lake Chauncey treatment, we're recommending be an October town meeting warrant. We had the conservation, recreation, and Board of Health all met to discuss. And because we were unable to get the treatment started as early as planned because of town meeting, we're recommending that it be moved to the October warrant.
So, Christy, I don't think we want to have a long discussion about any of these tonight, but I guess we had lots of discussion about that particular item, the lake treatment. So what I heard you saying is because we haven't started that process now, that we would then be deferring it further. I would be concerned about the condition of the water source if we delay it. In the context, I know we're looking at.
So, yeah, we can certainly bring this back for further discussion, but my understanding is that because we would have voted it in March, we would have been able to start it sooner. And so that sort of the efficacy of the treatment wouldn't be there if we couldn't get it going sooner. And we also we don't have a good understanding yet of what our summer programming is going to look like and our ability to open the beach. So it was recommended by those 3 departments to move that to June, but we can certainly invite them in to have a conversation.
And Christy, can I just recommend that if we are having that conversation, that we include the Board of Health?
That's what I said, Board of Health, Recreation, and Conservation.
Yeah, I'm not sure that their rationale is the best on that, but so we can have further discussion on that.
Okay. Well, yeah, let them speak to that.
And a quick question, wouldn't this summer, if there was going to be a July 4th block party, wouldn't this summer's party be in the fiscal year 20 budget because it happens before June 30th?
It was a free cash, so they could have used it. Free cash articles you can spend sooner than July 1st. So this
Okay, thank you.
This will go into October. Yeah. So the next few articles are all capital plan articles. So they're subsections of Article 8. And this was at the recommendation of the department heads who had put them forward. So the DPW director requested to keep the majority of his articles that are funded either through the retained earnings or also ones that are needed for snow removal. So that especially where it takes there's such a lag time between getting the appropriation and ordering the vehicle. So that's a lot of these that you'll see here. With the backhoe replacement, he has recommended that it be moved to the October town meeting warrant.
I have a question about that. In the presentation, both on the budget day as well as to the capital planning expenditure committee, he mentioned that part of the motivation for replacing the backhoe was that the arm itself, when it swings, doesn't stop accurately, and it was creating a safety hazard.
Mm-hmm.
And so I'm wondering if it's enough of a safety hazard that we shouldn't delay that. So
I mean, I can certainly talk to him. I think that the place that we started from is that we think all of these should be on the upcoming town meeting warrant.
Understood.
And so we're just trying to figure out which ones can be deferred to October. Understanding that it's only a few months away, but that's a good question that I can follow up with him on.
Okay, thank you.
If we skip down to line 24, this is where we start with the 3 requests from the fire department. And so he's requesting that the command vehicle and the ambulance purchase still occur at the June meeting, while pushing out the self-contained breathing apparatus to October. And so the reason for that is that there's a grant opportunity that he would know about by October, that he may be able to purchase them through this grant opportunity as opposed to having to go through town meeting. I know he had talked to you about the expiration of what he currently has, and he feels he could still meet that timeline.
Christy, this was one of the, I still remember the presentation on this. And so he's okay with the delay till October on this?
It was his idea, his recommendation. Yep.
Okay.
Yep.
Yeah, echoing probably what Syed's not saying, that one just makes me very concerned about pushing that out, because, I mean, I realize it's a lot of money, but there are a lot of lives that depend upon it.
Certainly don't want to come off like we don't appreciate that, but that was my reaction. She certainly, feels that this is appropriate, and he believes that he could get it funded through an opportunity.
Yeah, just want to kind of
what's not being said is it sounds like he feels like delaying it is not going to harm the safety of his firefighters. That he feels like.
Yeah, no, and I know he wouldn't recommend it. I fully understand. I want to, if we're going through a round of questioning of things, that would be one that I'd be highlighting in yellow to say, let's make sure we're sure it makes sense to push it off.
Because the ones they have work, it's just they're getting older and older, and he has to replace parts and take them apart and do stuff like that.
So maybe for your next meeting, we can plan to have everyone with a capital article come and discuss.
Good.
Christy, can you, because I don't have those warrant notes, my budget notes and stuff in front of me, the row 23, the renewable energy study, that's the DPW one that Chris presented?
Yes.
Okay, thank you.
Yep. Line 27 here is the purchase of the 4 cruisers. And so the chief has split that in half. So bringing 2 of the vehicles in June and then 2 in October.
And some of that funding comes from the Sustainable Westborough grant.
Right.
And
so
now
we need to act on that request. Otherwise, we lose that money.
Right.
But I guess the question is, for this one, if we're delaying the hiring of additional 2 police officers, I thought part of this was to basically have cars for new hires. Do we still need all 4?
I can respond, Christy, if you'd like.
I didn't know you're still here. Yep.
So basically what I did was we would lose one green cruiser. If you cut that, and I said to finance and to the board, if we do hire that officer, I want to add that cruiser to the fleet. If it's decided to not hire that officer, if we're going to cut all 3 positions next year, then in October, I would drop one of the green cruisers.
Okay.
If that answers the question.
Okay.
So,
thank you.
So Jeff, have you talked to Sustainable Westborough about splitting it this way so that you would get the one green in October and one in June? Does that meet their timeline?
I have not, but I will.
All right,
I'll reach out to them.
That's a good idea. Speak to Pete.
I'm sorry, just to go back to while we're talking about green things, number 23, the renewable energy study. Is any of that, is that a matching grant program?
It's not a grant. It's a study being funded out of retained earnings.
Okay, so we're not putting up 50 and it's being matched in some sort of way through some sort of program. Okay, thank you.
Line 28 is parking lot improvements at the school. I put it out here as something that might be deferred just because of the sort of construction season. I have not talked to the school department about whether or not they're comfortable with that. So that's just how we put it up here. The replacement of the 2 1-ton dump trucks, that's the one that has the grant, the VW grant. Those trucks need to be in operation by August 21st. And so we actually have we've identified an alternative funding source for that match. And so our recommendation is to remove that article or to pass over the article.
Oh, good.
The T-mower for the country club is the $42,000 in June. Line 31 is the request to fund the internship, which is the transfer of the $500 from the budget to the article. My recommendation would be to pass over this article so that money could go towards the FY20 offset.
What does that mean, offset?
So you'll remember when we talked about the budget previously, we talked about the fact that we would be short on our revenues because of the shutdown, specifically hotel, motel, and meals taxes. And so we were identifying any unexpended budgets that would help us sort of offset that shortfall. And so if we were to leave that $500 as an unexpended budget item, it would go towards the FY20 shortfall that we're experiencing due to COVID.
Okay.
The kindergarten would be something that we would recommend continue in June. The land acquisition is for 30 Belknap is currently still in June. We're still sort of working with the seller. Also, if you'll recall, there was a potential grant opportunity, and so we need to understand whether or not that grant opportunity is going to impact our ability or when we can have that on the town meeting warrant. Nine Grove, we're in that purchase and sale agreement, so that would be a June article as well. The land acquisition for off Oak Street, we would still recommend that happen in June. As you'll recall, we don't even expect that would be the full $5,000 because it's really survey filing fees. That this would allow us to just sort of put that issue to bed when the state's ready to do that. The water system improvements, we're recommending that moves to October because of the timing of the appropriation. We wouldn't have the full construction season to start this work, and so October would put us in a just as good a position. The water management improvements and the sewer system improvements we would keep for June. amend the appropriation of the CSX mitigation. That's mitigation money that's specific to the purpose. So the only reason to push it to October would be to shorten the actual town meeting warrant. I know that there was conversation about a possible interest in doing that, but in terms of sort of its impact on the budget, there's no impact, and really this money is for a specific purpose. So. Then the rest of the articles, there's no appropriation. Article 40 is the acceptance of a section of statute that allows us to create those capital stabilization funds. And then the next two articles are the actual creation of the stabilization funds. And those we would want to happen in June because they need to be created in the fiscal year prior to any money going into them. The amendment of the general bylaws is the amendment to the revolving fund amounts. And so that's something also that we think is important to happen in this fiscal year, if possible. The next two articles are the adjustment to the senior tax work-off program and also the veterans tax work-off program. Those could happen in October. There's no money attached, there's no appropriation attached to them. They could happen in October and still be applied in fiscal 21. So the only reason, again, to move them to October would be to shorten the June town meeting warrant. The zoning bylaw is something that both the building department and the planning department have requested remain on the June town meeting warrant. And then the citizens petition is something that would have to remain on the June town meeting warrant. So again, I'll send this out to you. It's still in draft form. And, you know, I've taken note of all the departments that I think you'll want to talk to.
Christy, can I just ask a question related to some of these that were pushed to October? Is there potential for any of them to push them beyond that, in the sense like the July 4th of just not vote? I know it's still free cash, or the Chauncey treatment, and putting them on the March annual for the following year, as opposed to even dealing with them, because we've to the points of having missed and passed. And I guess the other one would be the borrow of the 1.8. If we've missed the season, and we would have made it if we did it in March, is there any, is it maybe more appropriate to move it to next March's meeting?
Yeah, I think it's a good question. I think that they're all, some of them have some sort of deadlines on them, like the self-contained breathing apparatus, but I think that all of them would be, up for conversation when we get to October in terms of understanding, what the budget looks like at the time and what the revenues look like. So, yeah, I can, if we push it to, if we want to make that decision now, we can certainly talk to the department heads about it.
No, I think it actually, now that I think about it, is what we're doing here is pushing it. So if with June's town meeting, we wouldn't be acting on it, and then we have to set the warrant for October separately anyways, and we can determine at that time whether it makes sense. I think that's fine. Okay.
I did just get a text from Chris, our DPW director. So he will come on and talk to you, but he just wanted to let us know that he doesn't consider the backhoe arm an immediate safety concern. So that's why he thought it was appropriate in October.
Okay, great. Thanks for that.
Watching us at 8:44.
Christy, this is Syed.
Yep.
So again, thank you for this. And I know that as you and your staff work through this, it would be also helpful as we look at the stuff that we're going to keep on the warrant, to, as best as you can, give us the impact on the the property taxes for the, just like you did for the, when you first presented the initial budget. Like, if we keep these on for June, what is the impact on the property taxes? What happens if we move them to October? So if you can game plan that would be great. The second is, go ahead.
Oh, no, go ahead. I'll answer when you're done.
And the second is, I guess, emotionally, since I'm the guy that started the internship. I know a lot of people may have lost their internships, So I don't know if it's worthwhile taking it off, but I can think about it, and I want to hear what the board has to say.
You mean lost their internships with the town?
Like, for instance, I mean, people may have had plans, and those plans are gone, and so if this gives them an opportunity to work in the town and potentially get some money, I don't want to deprive them of that opportunity. But we can talk about. We don't need to talk about it tonight. But my bigger thing is, I'd like to understand the financial impact on our residents. If once you guys sort this out, to understand exactly how much each of keeping these, the articles that we keep on in June, how much of an impact that has, how much of an impact that'll have in the end of the year property tax bill. And so that's my point.
Yeah, I think Syed, it's minimal. I think Christie's highlighted it here. I mean, the biggest thing, of course, is the operating budget that we go through. Beyond that, most of what's on here is free cash. So it's not impacting on the tax bills. So the only other two there I think that are highlighted was the $7,250, and then the Chauncey treatment at $15,000. So
essentially, whatever she presents for the operating budget will be kind of our residents will know, hey, this is kind of what we're going to be looking at. Yeah,
that's the impact. That's really the impact on the tax bill.
And don't we set the tax rate after the October meeting anyway?
Yeah.
So it's as though it was in there now. I mean, right up to then.
Yeah. So we do always estimate it in March, which we had estimated it for the upcoming March meeting, and we'll certainly estimate it for June, and then we always estimate it again in October, and then you set it in November. So I will get this out to you, and I will ask the departments to come to a future meeting.
And Christy, on line 6, which is the operating budget, you have in your town manager report, which we haven't gotten to yet, your second item is that we're still waiting on some final numbers from the school. So that's there could be a direct impact to Syed's question.
Yeah, and so the final numbers from the school, and also the final number when we go out to borrow next month will be impactful.
Yeah, I think the schools had asked to have to the end of the month, so we expect something end of this week or early next week on that one, and then, yeah, as Christy said, the borrow piece, which will happen sometime in mid-May.
Yep. Great.
Any other questions on that one? Thank you for putting that together, Christy.
Sure.
Thank you. Very informative.
Okay, so the next agenda item, discussion vote to execute a settlement agreement with John Walden.
So this is just an agreement that we've been working with John Walden on regarding any money owed to him. So, we've worked with John and the agreement's complete. So if the board wants to vote to sign it, we can finalize it.
What kind of a motion do you actually need, Christy?
I think I've got it.
Put it in here.
Okay.
I move we vote to approve the settlement agreement and release of all claims between Town of Westborough and John Walden as presented.
Thank you.
Is there a second?
That.
Okay, any discussion or questions?
So,
sorry, go ahead, Lee.
Oh, Shelby.
Oh.
No, go ahead, Syed. You were first.
I was just going to ask, is this also one of those things we need to come into Town Hall to sign?
Yeah, this one will get signed. Yeah.
Okay.
I'll print it and drop it off on my way home.
You're like our courier. Thank you. And if you would please, as chair, because the public isn't necessarily looking at this, but they'll read the minutes and all, if you could just kind of briefly summarize what's in the agreement.
Sure. It was basically brought to us with the retirement of John Walden about some concerns about past monies held or owed, So this is really that settlement agreement with us, and then release of any future claims to that. And this is the net of that is a payment of a gross amount of $11,958. And that will
Thank you. I just wanted to kind of hear that in full transparency. Thanks.
Yep. Thank you.
Yep.
Okay, so we have the motion and the second. Roll call vote. Selectman Marshall.
Yes.
Selectman Edinburgh.
Yes.
Selectman Emery.
Yes.
Selectman Hashmi.
Yes.
And Selectman Johnson, yes. That's 5-0. 5 being present. Great. Christy, over to you for town manager's report.
Yep. So I just wanted to update you on the COVID-19 information, which is that the task force continues to meet weekly. One of the things that we did over the weekend, which we put in our Code Red update, was that we've launched an information phone line, which Sela is answering for us right now. And she's also logging those calls, so we're understanding exactly what what people are asking and what they might be in need of. So we would encourage people to reach out to departments if they know who they need, and otherwise to contact us on the information phone line, which is at 508-871-5111. And then also, we also have a COVID email address, which is covidinfo@town.westborough.ma.us. And then we also continue to update the COVID information on our website. And so I would encourage people to also go to that. And we also are keeping our social media page up to date. So if people are following us or they're not following us, they should follow us, because, we're trying to keep information going out to the community. And then just the update on the FY21 budget, which I've already talked about, was that we were able to find about $55,000 in additional reductions from the DPW and the Historic Commission budgets. And the final proposed budget will be presented after we go out to borrow in May, so that we can understand what our debt budget needs to look like. And then this is the first time since the pandemic has hit that we've asked the department heads to give us updates. And so I have several updates here. The police department update is that they're working on their policies and procedures for their credentialing. The patrols have been out, directed to go to the walking trails and parking lots to make sure people are in compliance with both social distancing and our leash laws, because we've gotten a lot of concerns about the number of people using the trails and not following the leash laws.
I think that's wonderful, Christy. I think that will put some people at rest and maybe will quiet some complaints.
Yeah.
Thank you.
Yeah. The police department is also participating in a lot of community policing. If you follow them on Facebook, you see that they've done a lot of drive-bys for birthday parties and different parades, and sending cards. It's just a great way for them to reach out to the community when people are stuck at home. And then they're also working on health initiatives. So they're certainly making sure that their team is well taken care of during this COVID period. The library is doing amazing virtually. So they've just exceeded 25,000 minutes, which is 423.3 hours of digital content watched. I myself have participated in some of their content, and it's great. They're developing they did develop a virtual Zoom-based escape room, which I think it'll launch this week. And Maureen has told us that she got to test it out, and it's pretty cool. And then they're also doing virtual library days for the Arrive Apartments, which they had previously gone out and done sort of a traveling library program, but now they're working with them remotely, which is great. They've been very creative during this time. The Youth and Family Services, I was asked about the interface, the use of the interface. So there have been 38 calls from Westborough between December 1st, 2019, and then also in April 22nd, 2020. And so they send us comprehensive reports twice a year. The Conservation Commission, this is just the update that was in your packet that Jordan had provided, so that when this gets posted online, it will go out to anyone who subscribes to this so that they can be introduced to Jordan. The building department just wanted to do sort of a public service announcement, which was that every year they see lots of signs in town for graduating seniors. With the pandemic, they expect to see even more. And he just wants to remind residents that if you are putting those signs up in your yard, to please make sure that they're well secured to the ground. The planning board has given a lengthy update on the master plan. And so I would just summarize it by directing everyone to the master plan page so that you can participate in the interactive piece of the master plan. That's something that you can go directly to from the town's website, the homepage of the town's website. But there's lots of opportunity for receiving input, and we're really hoping that a lot of people will participate. And then he's also provided information on improvements that are being made to the intersection of Mount Pleasant Street and Deerslayer Lane, which I'm just noticing the copy of the plan actually didn't make it into your packet, so I'll make sure to send that out.
This is related to the Silver Hollow Estates development and work done by the developer on that intersection.
And that's it.
Perfect. Anything else you have?
I don't have anything else.
Okay, perfect. Okay, issues and correspondence of the Selectmen. Who wants to go first?
Sure, I'll jump in, Ian. This is Shirley. I just wanted to give the board and the public a quick update on some of the work of the task force. Christy's already done a great job sharing some of the key highlights. I did want to let folks know that we are steps away from establishing a fund, for a community fund that the Rotary Club will be administering, and to which those who are able can donate to. The funds will then be distributed within Westborough through grants to organizations who demonstrate a need. And as you might imagine, the fund is intended to help those to address food insecurity, potentially help the utilities, and to address other needs that are as a result of COVID. So expect more information on that. We'll work with Westborough TV and the Community Advocate, et cetera, the boards, the signs to publicize that. So very excited, and want to thank everyone who's been involved in that project. I also want to reiterate the importance of, for folks who have questions, to continue to work with the departments who they would normally contact. If you have a question senior related, call the senior center. If you have a question about DPW, call them. But if you don't know where to call, please utilize that email address that Christy already shared, and which is on our COVID-19 page, or the phone number. Sheila is doing just an amazing job fielding those calls and tracking them, and then triaging them to the appropriate department. So want to encourage folks to use that. The other piece that I would just encourage folks, I'm just looking at my notes, is lots of questions have come to me. I'm sure other members of the board have received it, of like, I want to volunteer, I want to help. That's great. You can certainly submit a request like that through the resource line. Let them know what your particular skill, talent might be, your interest, so that we can gather that information. As the public might appreciate, it's a tricky balance between hands-on volunteering and social distancing, and doing that safely and in compliance with the Board of Health, and wanting to keep our numbers down. But we continue to see creative ways, already discussed here tonight, in which the public is, contributing to help their, fellow residents. So when the veil of this craziness all lifts, the need will probably be greater than it is now, because, it just will be. So let the town know if you have a particular talent or area you want to volunteer in. And we'll definitely be gathering that information and figuring out how to kind of, so to speak, assign folks. And I just want to thank again everyone who is essential, whether you're carrying, delivering, cooking, whatever it is that you're doing to keep things moving forward. Thank you so much.
Shelby, will there be any sort of discussion about a mortgage relief program similar to what Boston is doing, or?
So the task force has not specifically discussed that. I do know that there was obviously the eviction legislation came up through the governor, through, the state at the state level, as well as in that, again, I don't have the legislation memorized, but there's also language around mortgage. What's the word I'm looking for? Help me out here, anyone?
Forbearance.
Thank you, Alan. That is in that legislation. So we haven't pursued that further. Syed, I know that you had mentioned something about like a regional kind of discussion, but at this time that has not been raised as a primary concern. And I guess I would further say one that would trump or supersede what the benefit of what's already been done at the state level. Okay, no, I think the priorities that you've outlined are the ones that are critical. So, but I will say, Syed, to your point, it is there's a balance as a member of the task force. I think there's a balance between hearing there's a need, people are struggling with becoming more specific in the requests. So if folks are aware of a need, again, even if it's not your need, but you're aware of maybe a family struggling or what have you, call Youth and Family Services, call the Senior Center. Let's look out for each other. And I know sometimes as New Englanders, maybe it's not in our nature to do that because we like fences and stuff. But now more than ever, we need to look out for each other. And even if we can't fix what we don't know about. That's it. Thank you for your time.
I think that was well said, and I do think perhaps a slight difference from what Syed's asking versus what was in the legislation. The legislation was, as I understand it, is basically not allowing for evictions for non-payment of rent or foreclosures based on non-payment of mortgages. However, it's not a waiver or a removal of the need to pay rent or pay mortgage. That it's not waiving those costs that individuals have. So I think you hit the nail on the head. If there's folks that are struggling because of things with rent payments, et cetera, that's where the fund will be there, and that's where the contributions from our residents and businesses, whatever, that potentially could be used to help aid those in need with things, food, housing, medical needs, et cetera.
One more piece I'll add to aid that you just mentioned, Ian, is the food pantry. So the task force is working with a number of organizations just as members of the task force, but in particular the food pantry. We're working very closely with Phil and his team to determine a safe reopening date. Obviously, we'll do that with the Board of Health because while they continue to do an amazing job of handing out gift cards, the value of a gift card is greatly diminished versus the amount of food that could be given out for $100. So I want to encourage folks, if you need food, please contact the food pantry. They will ensure that you get a gift card. They've increased the number. They're handing those out every 3 weeks now, and at a rate of about $17,000 a month. So anyway, so thank you for your time.
Great. Lee.
Hi, thank you, Ian. Just two things. The Board of Health spoke about this earlier today, and not everyone may have been watching that part of it. They have now asked all of the businesses in town that have staff that have contact with customers, like grocery stores or Lowe's Lowe's, Home Depot, where customers and and staff are interacting, that all of their staff wear masks. And they're doing a good job, the businesses are, takeout and stuff like that, but they are complaining a little bit that customers are coming in without masks. So the Board of Health is going to send out an advisory. We can't insist on this, but really asking the public to be much more aware of what your role in keeping those people's lives safe is. If they're going to put on masks for you, please put on masks for them. And then I just wanted the Board of Selectmen to know that Alan and I would like to put on our next agenda a review of the committee handbook.
Awesome. Great job.
Well, it's mostly Alan's pushing it in, but we are going to get it there.
You say great job until you get the document and you have to read it.
Right.
I want the crypto version. Great. Alan, since you are off mute there, why don't you give the next?
Okay, a couple of things. One for Westborough residents who own a small business or folks who have small businesses in town, the Small Business Administration's Payroll Protection Program with the second round of funding has opened again. Banks started accepting applications again at 10:30 a.m. on Monday. If you applied in the first round and weren't processed or did not get a loan confirmation number, it's important that you contact the lender to make sure they are resubmitting or still going to process that application and they don't need you to refile because the dates have shifted. If you didn't, you're looking to know that in this round of funding, about 22% of it was earmarked through smaller lending institutions and credit unions. So if you don't have a current SBA lender, you may have better luck by going locally to a Central One or St. Mary's or a Nvidia Bank rather than one of the large national banks as far as getting time and attention and assistance in getting that critical funding for your business. On the personal side, in one of the recent rounds of the executive orders coming out of the governor's office and work in the legislature, the state has the Executive Office of Housing and Community Development, which is the executive branch that actually oversees DHCD that we work with all the time. It has a longstanding program called RAFT, Residential Assistance for Families in Transition. They recently added $19 million to this fund, specifically related to COVID-19. So if you are a renter and you meet their income guidelines and it's related to COVID-19, there's a program where you can get financial assistance of up to $4,000 to cover rent and housing related expenses. And so I believe, Krista, you got copied on some of the information we can provide for our town, our region. It's managed by a nonprofit called RCAP Solutions, located in Worcester. We can have the phone number and a link to their website on our website, and people can reach out and get that assistance. And along that way, as far as with all the discussions we've had on mortgage, people might be struggling with mortgages. The research I've done is one of the challenges is mortgages are regulated at the state level, but most banks are chartered at the federal level. So there's conflicting rules on what they're allowed to do. So I've talked with a couple of mortgage lenders and basically want to pass on that if you're struggling to pay your mortgage, contact your bank before you reduce or miss a payment. It's a two-step process. The first step of the process is forbearance, where you don't make payments for a period of months. Usually it will be typically right now it's 90 days, it's 3 months. Normally at the end of forbearance, you owe all of the money all at once. But what the mortgage lenders are saying is phase 2 is when you get the end of the forbearance period, they can extend it for another 90 days. And at that point is when you would then negotiate a payment plan on what you could afford as far as you could be incremental payments on your mortgage for the next 15 years to make up that difference. And the mortgage lenders have a lot of flexibility in what they're able to do to help you out. But it's important to have the conversation before they flag you as a problem account rather than after. So if you think you're going to have trouble with your mortgage, talk to your lender first before you just skip a payment or make a partial payment. And they'll be able to get you into that two-step process. for assistance there. And I just want to say, again, echo Shelby thanks to the folks out there who are keeping our goods flowing and our services flowing, and are out there in a not great situation doing the best they can, and making sure that we all have the food, the shelter, etc. that we need. So thank you very much. That's all.
Great. Thank you, Alan. Syed?
This is first couple of just holdover items from previous discussions. One, Christy, I've had some correspondence about, and you may have been CC'd on it, on the Fisher Street Bridge. So I was wondering if you could send an update to the town on where we stand. You don't need to give it to us now,